If you're dealing with numbness and tingling in your arm, I want you to stop and pay attention to this because what's causing it might not be what you think. And if you're ignoring it because it comes and goes, that's actually the part that concerns me the most. Here's the thing, numbness and tingling in your arm has a long list of possible causes. Some of them are simple, some of them need to be caught early. And a few of them are things people are accidentally making worse on their own right now without even knowing it. By the end of this video, you're going to know how to think about this problem the way that I do, so you can stop guessing and start getting the right answers. In this video, I'm going to cover three things. First, a simple way to tell whether your symptoms need urgent attention or not, starting with one question that I ask every patient. Second, a surprising cause of arm numbness that has nothing to do with your spine, and a quick self-test you can do right now to check for it. And third, something most people with these symptoms are completely missing whenever it comes to their vitamin intake, and it's probably making things worse. I'm Dr. John Brockway. I'm a chiropractor here in Denver, Colorado, and I specialize in corrective chiropractic care, specifically diagnosing and treating the structural causes of chronic neck and arm symptoms. I see patients with exactly this kind of presentation regularly, and there are patterns that show up again and again that most people, and candidly, even a lot of providers, miss. I want to start with a patient that I saw not long ago. He came in with numbness and tingling in his left hand. He'd been dealing with it on and off for a couple weeks. And based on where he was feeling it, the pattern kind of looked like it could be coming from his neck. So we started down that road, but something didn't sit right with me during the exam. The presentation wasn't quite matching what I'd expect to see if the cervical spine was the primary driver. Before I jump ahead, I need to cover the most important question that I ask first, because it would have changed everything if his answer had been different. The first thing that I want to know when someone comes in with arm numbness is simple. Is it one side or is it both? One-sided numbness, one arm, one hand following a specific path down into certain fingers, that pattern points me towards the nerve roots in your neck. Each level of your cervical spine is responsible for a specific region of your arm. C6 goes to your thumb and your index finger. C7 to your middle finger. C8 runs down to your ring and your pinky finger. When a disc or arthritic change is compressing a nerve root at one of those levels, you tend to get numbness that follows that roadmap. It's called radiculopathy, and it's one of the most common things that I treat. Both sides is a completely different conversation. When numbness and tingling shows up in both arms, or both arms and both legs, that raises the possibility that something is affecting the spinal cord itself, not just a nerve root. That's called myelopathy, and I don't want you sitting on that. If your symptoms are bilateral, meaning both sides, that's not a wait and see, that's a get this checked and get it checked soon. Now, back to my patient. His was one-sided, so we kept looking, but here's where it got interesting. When someone comes in with a numb hand, the spine is the first place most people look. And most of the time, that's absolutely right. But I've learned to look at the whole picture before I commit to a diagnosis. I had a patient come in, numb, slightly swollen left hand. Classic presentation on the surface. During the exam, I happened to notice his watch. It was tight. Really tight. We're talking cutting into the skin tight. I asked him to take it off. Within a few minutes, the color started returning. The swelling began to ease. It wasn't his neck, it was his watch. Now, I'm not saying that's what's happening with you. Most of the time, numbness in your arm does have a spine component. But that case stuck with me because it's a good reminder. A good clinician doesn't just confirm what they expect to find, they look for what they might be missing. Which brings me back to my patient with the left hand. Because what I was missing turned out to be something I almost never see come up in a chiropractic office. Here's something that doesn't get talked about enough in this space. The vascular system, your blood vessels, can produce numbness and tingling that feels identical to a nerve problem. When blood flow to a limb is compromised, the tissues downstream don't get adequate oxygen. That produces symptoms, coldness, color changes, and yes, numbness and tingling. One condition called Raynaud syndrome causes vasospasm. The small blood vessels in your fingers clamp down in response to cold or stress, and you get that same pins and needles feeling, color changes, and even pain. It affects somewhere between 3 and 5% of people, and it's more common in women. Here's a quick screening that you can do right now, and I want to be clear, this is not a diagnosis, it's an awareness tool. Press firmly on your fingernail until it turns white, and then let go. Color should return within about 3 seconds. If it's taking noticeably longer than that, or if one hand is consistently slower than the other, that's worth mentioning to a provider. I also use thermal imaging in my office as a screening tool. It picks up temperature differences between limbs, differences that can signal uneven blood flow. Again, screening, not a diagnosis. But it gives me information that helps me decide whether this person needs a vascular referral or whether we stay in the cervical lane. Now, the specific patient that I'm thinking of here actually had lower extremity symptoms, not upper. But I want to tell you this story because the principle is identical regardless of which limb is involved. The vascular system doesn't care whether it's your arm or your leg. Compromised flow produces the same category of symptoms either way. She was co-managing her care with a vein specialist that she was already working with. What the workup revealed was a significant vascular component contributing to her symptoms. The vein specialist recommended a procedure called vein ablation, and after that procedure, she reported meaningful improvement. The reason I bring this up in a video about arm numbness is simple. If nobody had been looking for a vascular contribution, it never would have been found. She would have kept chasing a neurological explanation that wasn't the full picture. That's the habit I want you to take away from this section. When the symptoms don't fully add up, when the pattern isn't clear, when treatment that should be working isn't working, ask whether someone has looked at the vascular side of the equation, because it's a question that doesn't get asked often enough. But there's one more category that I want to cover, and this is the one where I see people actively making their own symptoms worse while thinking that they're actually helping themselves. A lot of people dealing with arm numbness and tingling start self-treating with B vitamins. And that instinct isn't crazy. B vitamins do play a role in nerve health. The problem is that most people don't know the full story. Here it is. B vitamin deficiency and B vitamin toxicity can produce identical symptoms. B12 deficiency is one of the more well-known causes of peripheral neuropathy, that numbness, tingling, and weakness in the extremities. What most people don't know is that neurologic symptoms can show up before any blood abnormalities do. Your labs can look perfectly normal while that nerve damage is already happening. B6 is the one that really surprises people. B6 deficiency can cause peripheral neuropathy, but, and this is the part that matters, mega doses of B6 also cause peripheral neuropathy, the same symptom. According to the Merck manual, ingestion of megadoses of B6, typically over 500 milligrams a day, amounts people sometimes take trying to treat carpal tunnel syndrome or other conditions, can actually cause peripheral neuropathy with progressive sensory changes. And here's something that I want you to try right now. This is a quick early warning screen for B6 status described by physician Dr. John Ellis. Hold your hands out in front of you, palm facing up. Now try to just bend the two middle joints of your four fingers, not your knuckles, until your fingertips touch your palm. Do it with both hands. If your fingertips aren't making it to your palm, or it's noticeably harder on one side, that can be an early indicator of B6 insufficiency. Now, I'm not telling you to go take more B6. That's the whole point. If you're already taking a B6 supplement and your symptoms are getting worse instead of better, more is probably not the answer. Go get your levels checked, because the line between deficiency and toxicity with B6 is something you can cross without knowing it, and both sides look the same from the outside. B5, pantothenic acid, also plays a supporting role here. If you're experiencing frequent tingling in your hands and feet, making sure your full B complex is covered, not just isolated B6 or B12, is the smart approach. So what do we actually do when someone comes in with numbness and tingling in their arm and the workup points to a cervical cause? First, we confirm what we're dealing with. X-rays, including stress films that look at how the cervical spine moves under load. We want to know whether there's disc involvement, arthritic change at a specific level, and critically, whether there's any instability present. Now that last piece matters because it changes the treatment approach, and I'll explain why in a moment. For confirmed cervical radiculopathy, a nerve root being compressed or irritated at a specific level, the treatment approach that I use often combines several things. Chiropractic adjustments targeted at the involved level and the levels around it. Radiculopathy doesn't always follow a perfect textbook pattern. The tenderness is often present at the primary level and the levels above and below it. The adjustments work through neuromuscular pathways to restore motion and reduce the irritation at the root. Laser phototherapy to support tissue healing and reduce inflammation at the nerve root level. Soft tissue work targeting the scalenes and SCM specifically. Those anterior neck muscles are almost always involved in cervical radiculopathy, and they often get overlooked. I use a technique called pain neutralization technique developed by Dr. Stephen Kaufman, which I'm extensively trained in. It's a precise neurological approach to releasing trigger points that I found particularly effective and the tissues surrounding the cervical spine. And then cervical curve correction, the Denny roll, the prolordosis exerciser, the posture halo. These tools apply a sustained corrective load to help restore the natural cervical curve, which takes mechanical pressure off of the nerve roots over time. One thing I want to be specific about here, these tools are not something I just hand people and send them home with. Once a patient demonstrates proficiency using it in the office, and once we've confirmed through x-ray that there's no contraindications, we continue that work at home as a part of their plan with ongoing supervision and regular check-ins. The x-ray piece is not optional. If instability is present, the sequencing changes entirely. We address that first before introducing any sustained postural loading. If any of what I've described in this video sounds like your situation, the pattern of symptoms, the one-sided presentation, the numbness that follows a specific path, or the picture that just hasn't fully made sense yet, the next step is getting a proper evaluation that actually looks at the structure of your cervical spine, not just a standard MRI. Be sure to like, share, subscribe, and comment for more helpful content just like this one. And if you want to understand why standard imaging often misses the real problem, I have a video that explains exactly that and why the type of x-ray matters more than most people realize. Watch that one next, right here. I'll see you on the next one.